Hello and welcome to Business Continuity Planning for a Pandemic. My name is Frances Eisman and I'm a consultant at PSHSA on the community healthcare team. I service the Hamilton-Niagara region. This presentation focuses on the broader public sectors, but it can apply to any sector. When adverse or catastrophic events occur, such as widespread pandemic, the impact on business can be devastating. So it's important that organizations have a business continuity planning process. So what is a business continuity planning? It is an essential strategic planning process that can assist businesses in the development of a comprehensive and effective business continuity plan, also known as the BCP. The BCP will enhance the business resilience during a pandemic, provide guidance and direction to workplace parties and stakeholders so that business can continue to operate safely under changing conditions. It will provide guidance to a business on how to prepare and adjust business activities and functions when emergency events occur, such as a pandemic, and organizations that have a business continuity plan in place can respond quicker and with greater focus. So what are some of the benefits? It will help ensure businesses have timely information and guidance to operate. It will help ensure compliance with legislation and standards and government directives. It will help reduce interruption, maintain or protect critical business functions, and also minimize job and revenue loss. In addition, it will enhance procurement and maintenance of resources, such as personal protective equipment. It can help optimize human resources, staffing, communications, and efficiencies, and it can help protect those people that we serve, as well as worker health and safety. And as a health and safety association, this is a major focus for us in terms of protecting both our clients and our workers' health and safety. So why is planning important? We all know that good intentions are not good enough. A goal of protecting people and business continuity without a plan is just a dream. Business continuity planning is essential because the health and safety of individuals, both workers and customers and clients, and the viability of our business or your business may be at stake during the event like a pandemic. It is the responsible and right thing to do for effective leaders, and organizations can make it a reality by adopting a planning framework, understanding the planning steps, and following a business continuity planning checklist to help identify planning gaps and to develop an effective business continuity plan. So here at PSHSA, we've developed a 5-step process. The first step is establish governance. Second step, conduct a business impact analysis, also known as a BIA. Third step, develop a business continuity plan. 4th step, communicate and implement the plan, and also prepare. Well, that would include mock drills and training. And the 5th step is evaluate and improve the plan. So the first step, establish governance, is really key. Establishing a senior management commitment to the development, implementation, and maintenance of a business continuity plan, and to provide necessary human and physical resources is really key. There needs to be an oversight structure such as a committee, working group, or task force. Organizations will need to identify leaders and committee members. It's important that organizations promote participation of management, staff, joint health and safety committee, worker member, or health and safety representative, and any other stakeholders, as they can provide important knowledge and information, as well as different perspectives in the business. And lastly, it's important that the organization develop a terms of reference that establishes the purpose of the committee, reporting structure of the committee to senior management, roles and responsibilities of the committee and committee members, decision-making methods, as well as how will they activate the business continuity plan and terminate the plan when the time comes. The next step, step 2, is conducting the impact analysis. or the BIA for short. First step is describing the purpose of the business, describe products and services provided, and also identify and describe business units and the critical business services and functions in the organization. If you're a very large organization, you will probably have to recruit the assistance of the departments and staff to identify some of these. If you're a smaller organization, it might not require as much involvement. What is really important is that we have a definition of a critical business service or function. And this one's adopted from the Niagara Region Public Health. And a critical business service or function can be defined as one that may lead to failure of a business unit if activities are not performed, and or one that, when not delivered, creates an impact on health and safety of individuals. So that could be the people that you serve or the public, or it could be workers as well. So it's important that you have a definition. You can use this definition or develop your own definition. So the next step in the business impact analysis is to analyze the impact of the pandemic interruption on each critical business service or function that you've identified. You will want to consider the impact on the people you're serving, whether it's customers, clients, patients, residents, and how it might impact their outcomes. For instance, if you closed a doctor's office, how would that impact people that need essential care? You will also want to consider the impact on your revenue, expenses, insurance, intangible losses like your reputation, contracts, and business commitments. You might want to determine whether there's any liability as a result of not providing services. Also, whether it affects your compliance with legislation and any other deliverables. And you also want to consider the impact of internal and external interdependencies. Most business units and functions do not work in a silo. Internal to the organization, other departments might be involved. External to the organization, other stakeholders might be involved. Internal interdependencies and impact might include employee availability, employee competencies, equipment, including PPE and facilities availability, computer applications, tools, data, vehicles, support services, such as HR, security, and so on. External interdependencies and impact might include suppliers, contractors, laboratory or diagnostic imaging if you're in the healthcare industry, external equipment and facilities if they don't belong to your business, computer applications, data, tools, external support such as facilities management, utilities, communications, transportation, and so on. So there's lots to consider. Once you've discussed that and identified some of those items, you will then want to rank and prioritize your critical business functions, consider how essential they are, and looking at the impact of time and duration if the service functions is suspended. So we have a prioritization sample here, some criteria that you could adopt, or you can use your own definitions or prioritization process. So in this situation, the higher priority is an A, where essential service and functions, where time is critical or very important. B are services and functions that can be suspended for a short period of time. And C, services and functions that can be suspended for a long period of time. And of course, you'll be focusing primarily on the A functions initially. Other impact considerations that organizations will want to look at is identifying suppliers and impacts on procurement of supplies such as PPE and supplies you require to do the job, evaluate employee skills sets and competencies, and also very important that some organizations don't always consider is you need to forecast new critical business services and functions that may occur or be anticipated because of the pandemic. And a good example of that would be screening, where you may not have done screening before, you didn't have people in that position, you may not have had processes in place or PPE. And so these are types of things you'll have to determine whether you will need them in the future. In a pandemic, we know for certain from even SARS and the COVID-19 is screening is essential, a critical business function that should be considered. Other activities such as surge activity, especially somewhere in the such as the ER, staffing shortages, or even virtual services and care, where you're not providing service in person and you're using technologies to do that. Also, part of the business continuity planning piece is determine the initiation and termination of the process. In our instance, in COVID-19, it's usually the government that is guiding us as to the initiation on the first wave and termination, and same with the second wave and the third wave if there is one. Also, you will need to establish business continuity reporting mechanisms, including roles and responsibilities. Also, ensure integration of the business continuity plan into the emergency preparedness plan. In fact, the World Health Organization in their documentation states the business continuity plan is part of the pandemic plan, or as mentioned here, the emergency preparedness plan. As part of this, step 3 as well is you'll have to plan and coordinate with internal, external stakeholders and consider logistics, information technology, human resources, finance, diagnostic imaging, if it's appropriate, procurement of supplies. Also, you will need to plan and coordinate with coordinators, external officials such as government officials, local agencies, public health, community partners, labor unions, legal counsel, possibly. And what's very important here as well is that you include and collaborate with your joint health and safety committees, worker members, committees, worker members, as well as the health and safety reps. We found from the Campbell report from SARS is that it's really critical that the Joint Health and Safety Committee continue to function. They need to continue to meet and do their inspections, although that things might be modified, but it's very important that they continue to function and be made aware of what's happening and be consulted. Also, you need to look at and review the business impact analysis findings as well when you're developing your plan. There's a number of policies and procedures that your organization might want to consider to implement well in advance of any pandemic to save you a lot of time and grief. And we've included some here. In the checklist, we've included several human resources sample policies, not so much the policies, but a list of policies. So you want to have those written well in advance. You might want to look at making sure you have a psychological health and safety policy or program, including mental health resistance, a robust training program, identifying what's mandatory, making sure that workers have the competencies to do the job, especially if they get deployed. So you're looking at things such as cross-training, looking at working arrangements and working from home and how that will be done. In addition, looking at restricting employers so that, and this happened both during SARS and COVID, that in some instances, workers are restricted to working with only one employer, not multiple employers, to reduce the spread. And also important to review and establish a really robust infection prevention control policies and procedures, safe work practices, as well as occupational health and safety policies, procedures, safe work practices. And that includes PPE, fit testing, and those types of things. In addition, you might look at establishing policies on restricted travel to reduce exposure, also environmental as well as equipment cleaning and maintenance, medical surveillance, reciprocal agreements with other organizations that you might work with or share resources with. Surge activity in case some departments become overwhelmed. Also policy and procedures regarding logistics, procurement, supplies, and equipment, and also for security, typically for access control and reduction of exposure to the pandemic infection in the workplace. Also in step 3 of business continuity plan is the importance of now developing essential critical services and functions and describing them. You want to plan for each critical business service and function based on your findings in the business impact analysis. You want to make sure that it minimizes impact to the services, and as you are able to provide it with the resources that you have. You will also need to determine how those services will be modified, enhanced, reduced, or in some cases, totally eliminated. So one critical department is human resources. And this section in our checklist is fairly extensive. And of course, it's not all limiting, but it's just giving you an idea of things you need to be looking at. But it's important that human resources maintains training matrices and training records of workers, a repository of jobs, and the required competencies and credentials for those jobs. And this will give you the ability to match workers to jobs, especially if deployment is required. Also a list of other workers that might be able to work during the pandemic, as if there is a shortage of workers, you'll be challenged. And also processes to address staff shortages and replacement, processes to monitor absenteeism and reporting occupational injury and illnesses as per legislation. That could include reporting injuries and illnesses to the Workplace Safety Insurance Board, or WSIB. It might include notifications to the Ministry of Labor, Training and Services Development, and it could also include reporting to public health. So, so there's no guesswork involved. It's important that policies and procedures are established so that these mandated reporting requirements are met. Also, there should be a concerns complaint process, and also know that workers do have the right to refuse safe work. So it's important that there are clear processes for that in place. And also making sure staff have accessibility to all the policies and procedures as well. For more information, I recommend that you refer to the business continuity planning checklist tool, which we'll talk about in a few minutes. Also, as part of the plan is making sure that there's communication and information technology plans, and that there's an infrastructure to support the various conditions in your workplace, including remote working conditions. It could be many other different conditions as well. Also, telecommunications considerations. All of us have had the experience now having a lot of online meetings, for example. And as part of your plan is you need to have a robust training program developed so that all staff are prepared. That includes emergency preparedness training, and infection prevention and control, and occupational health and safety control training on policies and procedures, as well as PPE, and that could include fit testing, also human resource policy and procedures training, hazard and incident reporting, as well as cross training. And the fourth step is communicating and implementing the plan which, although I only have one slide on it, will take some time, as you can imagine, and also preparing for the pandemic response and business continuity. So this could include a business communication process. So you need to have a robust communication plan and process so that communications and dissemination is timely regarding pandemic plans, activities at each stage and at each wave. Ensure communication plan provides factual and consistent updates, protocols and directives, and reduces fear and misinformation, and is consistent with the multi-level messaging from governments as well. Implementation coordination of the business continuity plan is important that there's a comprehensive plan to introduce necessary policy and procedures, communication processes and agreements and understandings, resources and procurement such as IT, supplies, equipment, and so on. And then finally, training delivery. And step 3 are developing the training, and in step 4, preparing includes delivering the training and practicing with mock drills. So you want to ensure instructors and facilitators are identified, selected, and qualified. You want to schedule and provide training to all the necessary staff to ensure they have the knowledge, skills, and abilities to carry out their activities, conduct mock drills, debrief after the drills, and identify lessons learned and share the information with the Business Continuity Planning Committee and instructors. And then also consider needed changes to the business continuity plan itself. And this brings us to the continuous quality improvement piece of evaluating and improving the plan. And so it's very important that organizations test their business continuity plan, review it, audit it, and review it. And it's suggested that it's reviewed annually. Once that is done, any shortcomings can be identified and quality improvement recommendations can be made to management, who can then approve and implement them. And what's also important and sometimes forgotten is communication of any changes to the business continuity plan to those that it affects. So really an important piece there. So now a little bit about the toolkit. So we have developed a business continuity planning checklist tool that will be posted in the next few weeks on our website. It will be free. It will have fillable forms, so you can download it and then populate it if you wish to use it. Know that it's a guidance document and you might want to add things to it or not use all of it. It's up to you. In the checklist tool, we have several things such as background information, business continuity planning framework, which we introduced both of those here in this presentation, who should use the tool, how to use the tool, and then the tool itself and references. So that's what we have included. Also note that if you're a small business under 50, we've developed also a small business continuity planning checklist as well. So in the tool, it will mention who should use it, and it's usually those that have oversight of the planning process, so that that business continuity planning committee or working group. It has steps on how to use the tool, and these are the steps. So review the business continuity planning background and framework, so you have a little bit more information about it. Become familiar with the legislation in your jurisdictions and guidance information related to emergency management. Prepare to gather, review, and analyze business information, capabilities, and processes, and then identify those business continuity risks and gaps. And then the committee can start completing the checklist to determine whether the business continuity elements are complete or in place, in progress, not started, or not applicable. So once that is done, the workplace can develop an action plan once they've completed that and address gaps, report findings and action plan to their senior management. They can communicate the action plan and target dates to those that were assigned to complete them. Then they can enter completion dates after each item is complete and notify senior management of the completion. Management has to ensure that the final plan is developed and executed and reviewed annually, and as well as communicated, implemented, and prepared. So this is just some snippets of the first page of each step. I didn't do all 20 odd pages. I just wanted to show you how we've set it up. So you can see it's the business continuity planning checklist. We have statements in the middle. Some of this information we just covered. And then on the left, you'll see whether the statement is complete, in progress, not started. This would be completed by the committee. And then if it's in progress or not completed, they can then identify the actions that need to be taken to complete that item and who's responsible, and identify target dates and completion dates. Step 2, conduct a business impact analysis is set up the same way with statements down the center. And you can go step by step and review them to see if you've got these things in place. And you might have, things might be partial or not started yet. But again, if they're in progress or not started, you need to develop actions, assign responsibilities, and then the target and completion dates. Step 3 is the developing of the business continuity plan. And again, this is several pages, and your committee would complete these as well. And then finally, step 4 is communicate, implement, and prepare. And step 5 would be your improvement plan. And so that's everything. Hope that was helpful and informative. The tool will be posted, as mentioned, on our website within the next couple of weeks, hopefully sooner than later. And you're welcome to contact me, and I'll just leave this up for a few moments. This is my email if you have any questions and or would like to speak with me about the business continuity plan. So it's ftheisman@pshsa.ca. I am also located on our website, Find Your Consultant for the Hamilton Niagara region. So thank you for attending, and please feel free to go to our website and enjoy the use of the tools. They're fillable forms, so it should be fairly easy and intuitive to use. Thank you.